Here's today's MercyOne Genesis Medical Moments.
And we are continuing our conversation about atrial fibrillation, also known as AFib, with Dr. Shen, a cardiologist here at MercyOne Genesis. So, doctor, you talked about some of the treatment options before with AFib. Are there any new treatment options that you're excited about?
Yeah, there are several new treatments for atrial fibrillation we offer here at MercyOne Genesis. So we talk about one of the invasive procedure to treat the AFib is catheter ablation. We talk about one of the way we can prevent stroke is by putting a device we call a Watchman. We recently started a concomitant procedure which combined these two procedures which historically were done separately into a single procedure. In fact, this morning, MercyOne Genesis, we just did another concomitant procedure. The benefits for the patient is obvious. Instead of coming in for the catheter ablation, have an anesthesia, recover, and come back again for a Watchman procedure, we combine two procedures in one. So much more convenient for the patient, much less complication rates for the patient. It's good for the society, good for the community to have this novel therapy we offer here.
Yeah, definitely. So who would you say is most at risk for this? How much does, age and gender play a role in having AFib?
Yeah, that's a very good question. In general, the older a person gets, the higher risk of atrial fibrillation can get you. Whether it causes more incidence of a stroke and also cause more incidence of congestive heart failure. These two are the major complications for atrial fibrillation. And in fact, women, gender, actually increases the risk as well. Okay. So I would say the people who are at risk the most would be women older than 75 years old.
Okay, let's talk about what would you say is the biggest concern regarding AFib for patients?
Yeah, the major concern for AFib comes with two. Number one, if it's a really symptomatic, it affects your lifestyle. You cannot do anything when you have a real symptomatic episode. You have to drop everything you're doing. You cannot go out abroad on a cruise or out of a town trip. There are patients who, once they have AFib, they really cannot function. On the flip side, if you don't have any symptoms, and that's sometimes our challenge as well, people will skip their medications, they will skip their oral blood thinners, and then they're at a higher risk of the complications we actually fear most. Number one is the weakening of the heart muscle, we call it congestive heart failure. The other one is a stroke. And the stroke caused by atrial fibrillation is oftentimes a big stroke, debilitating and oftentimes fatal stroke. That's why we really worry about.
Yeah, now are there things that can trigger AFib then?
Yes, so there are risk factors for atrial fibrillation. One risk factor is alcohol. Alcohol consumption has been linked with AFib trigger. A second is untreated sleep apnea. If you fall asleep and you stop breathing at night, you have this nerve surge and they can increase the incidence of AFib. Obesity is a potent trigger for AFib as well. There are non-modifiable risk factors such as aging. Age is a risk factor. So if we have a patient with AFib, especially a relatively younger person, we try very hard to educate them. Stay away from the alcohol, treat your sleep apnea if you have it, and try to lose weight. Regular exercise, and then try to lose weight. Yeah. And that's important.
And what would you say is the best treatment then for someone suffering from AFib? What's the goal?
The goal is any medical specialty. A doctor, when they see the patient, there are only two goals. Number one, to make a person feel better. Number two, to make a person live longer, right? We, as electrophysiologists here at MercyOne Genesis, when we see a patient with AFib, we try to achieve these two goals. We do catheter ablation to make them stay away from AFib. They can live in a better life quality. They can have fewer symptoms. They feel better when we restore their normal rhythm. We try to prevent their stroke, and that's directly affect their survival. So by offering treatment options, whether it's a pill form or minimally invasive procedures, we achieve two goals: make a person feel better and make them live longer. That's the goal.
Okay, so I know that there are different, treatment options, medication and some of the other things that you talked about. So how long does it take before someone starts feeling better and seeing results?
Yes, that's a very good question. I would say a lot of people, if they feel their AFib in a highly symptomatic way, after we do a more definitive treatment, such as catheter ablation, they feel better right away.
Really?
They feel better. In patients with a weak heart, on top of that, they have atrial fibrillation. If we can control their AFib, they feel better because they don't necessarily have those heart failure symptoms anymore. They can breathe better. Their legs, they don't get swollen all the time. The symptomatic relief after our treatment options, it can be very rewarding and it comes very, very fast.
Yeah, it sounds like it.
Yes,
It sounds like
yes.
it, definitely. So if someone is experiencing some of these symptoms that you mentioned, what's the first step that they should take?
So if a person feel the symptoms that may suggest atrial fibrillation, the first thing they should do is to get to their doctor or a doctor's office, obtain an electrocardiogram or EKG. We need a diagnosis of AFib by EKG. Sometimes this AFib comes and goes. We may not catch it when they're in the doctor's office. They oftentimes do a long-term Holter monitor or a 30-day monitor to catch one of those episodes. There are also commercially available devices which you can actually self-track your EKG, whether through a watch or some sort of device you can put your fingers on and record a 30 seconds EKG. And a lot of AFib was actually caught by those self-monitoring devices.
Yeah, we've come a long way then with technology,
right.
for
Yes.
sure, for sure.
Yeah.
Well, doctor, thank you so much for taking the time to talk to us today.
Thank you, my pleasure. Thank you.
And this was your MercyOne Genesis Medical Moments. And for more information, go to ourquadcities.com and click on the medical tab.